Welcome back to the Next Gen Online video tutorial. In today's video, we're going to go over how to generate an addendum as well as how to generate a communication and the difference between the two. First off, an addendum is only going to be added to locked encounters. So you know your encounter is locked when you see this locked button next to it. And in order to add in new information to this encounter, we're going to go ahead and generate that addendum. So let's say, for example, that we want to add in an addendum to this encounter for January 15th. We'll go ahead and select that encounter, come up here to File, New, Addendum. We'll select Yes, and we now see that this documents template here allows us to click into it. Before it was grayed out before we went to File, New, Addendum. And now that we've opened up the documents, the main thing I want you to pay attention to is highlighting addendum and clicking generate. And as you can see, for our January 15th encounter date, we now have this new folder just below it with today's date and time, and this is where our addendum is going to appear. So we can go ahead and type in whatever it is we wanted to add to that patient's chart. Maybe it was that we received the lab and x-ray results from Marina's emergency room and everything was normal. In order to save this addendum, come up here to the save icon, and once you hit save, it now allows you to sign off on this addendum. So we go ahead and sign off, and we've just completed how to add an addendum. So now let's go over how to generate a patient communication. And really there's two different ways to do it. You can do a communication while you have an encounter currently open. So for example, we see here that this encounter is open, and if we wanted to add in a communication, we go ahead and highlight it and select this telephone icon to our left side here. By hitting the telephone icon, it brings us into our communication page. And as you can see under this communication panel, this is where we have different topics for our various communications. In this particular case, we're going to go ahead and say it's a referral request. So all of these different types of communications are going to look relatively the same. The main thing you want to worry about is coming to the comment box and typing up what the communication involved. So for this case, I want to send a communication to one of the coordinators asking them if they got an urgent referral. So go ahead and type that out. And now in order to send this off to one of the coordinators or to another doctor, whoever the case may be, you come here to send and close. By opening up send and close, you get this task recipients page. And in order to send it off to the coordinators, we'll highlight their name, add them as users, and then press OK to send it off. If I wanted to send it to Dr. Briho, for example, I could highlight her name and add her as a user as well, and this communication will appear in their inboxes. I'll go ahead and refrain from clicking OK because we are in a test environment. And we can see here that our communication was captured. However, we don't yet see our communication in the patient history pane. All we see is that the communication template was open. In order to add the communication in the patient history pane, make sure you always hit preview document. So this will generate the communication document. It'll ask you to sign off on it. And we can now see that our telephone communication was added into our patient's chart. The other way to do a patient communication is, instead of it being documented within an encounter where you do the SOAP note and everything else, maybe in this particular case you had just got off the phone with a patient about a medication refill and you want to document that communication. In this case, we're going to go ahead and open up a new encounter for today's date, as we see here, and we'll come down here to this templates icon. By going to templates, we can then select communication and press OK. You'll be prompted to select your specialty, which can be family practice, and it'll automatically generate the visit type as a patient communication. Because we said we were going to do a medication refill, we'd probably choose medication management. And just as before, this screen comes up and you can go ahead and just worry about the comment box here and typing in what the communication was about. So in this case, we'll say we discussed tramadol refill with patient, will send prescription now. And in this particular case, I don't need to send that off to anyone, so I won't hit send and close. I'll just hit save and close. And we can see our communication got captured down below, but once again, it's not yet into our patient history pane here, only the template is. So we will always want to remember to hit preview document. And once again, just look over your communication and go ahead and sign off on it. And we can see here that it was added into our patient history pane. So in brief summary, we learned that when we want to add something into a locked encounter, we go ahead and generate an addendum. We also learned that we can send communications while we're in a patient's chart, and we can go ahead and task those communications to other providers, to coordinators, etc. And we also learned that in the case where the patient isn't at Venice Family Clinic and maybe we just talk to them over the phone, then we can go ahead and open up a new encounter, go to our templates and select communication only. And then we can go ahead and generate our communication. So that concludes today's video. Thank you very much for watching.